Good afternoon, everyone. Welcome to the IPC Health virtual meet. We will be starting the session now. Impulse's founder and CEO, Mr. Sameer Shariff, will be taking you through the session, followed by some of the key team members from the IPC Health. We will be playing the IPC Health corporate video.
Richard, the volume's not there.
Yes. We will be restarting the video once again.
And staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry with IPC Health.
IPC Health is a comprehensive learning, training, and skill development platform developed by Impulse in India for healthcare professionals to attain the right mix of content, learning, and skills that help them throughout their career. The platform offers a wide variety of courses that enable hospitals to meet their employee training and development needs in areas of quality compliance, soft skills, and induction. The platform is designed in a way that it enables easy tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with IPC's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience.
IPC Health, your learning partner. Let us come together to improve the quality of healthcare in India by spreading knowledge through technology and making IPC Health your learning partner.
Thank you. Now we welcome Mr. Sameer Shariff. Over to you, Sameer.
Sameer, you're muted.
Sameer, you're on mute.
So let me just... Great, thank you very much, Richard. So we have well planned 1 hour for everyone today. I will start and give you an introduction on some of the challenges that we've seen hospitals face in terms of learning and development. After I present my piece, we'll have Dr. Renu, who will actually talk about content and how to leverage content to do your learning and development. And then we will have Dr. Poonam, who will actually focus on impact management and how we actually helped hospitals with implementation of our platform, as well as how we help them with the whole learning and development and improving of productivity and quality of care. Post Poonam, Varun will actually talk about how you can get your return on your investment by putting a platform like IPC Health and the savings that you do get for using the platform. And then finally, Sai will actually give a full demo of IPC Health, touching on some of the main features. So let me get started. IPC Health is is a subsidiary of a company that I started 18 years ago, Impulsis, and we've been in the learning and development business for the last 18 years. We're about 800 people. We work with some of the best publishing and education companies in the world with real expertise in content learning and delivery. We work with some of the best medical publishers in the world. We're key partners for companies like the largest medical publisher, Elsevier Science, key partners for one of the largest healthcare nonprofits, the American Medical Association. We actually are the technology behind the advanced cardio life support and BLS certification. About 20 million certifications happen every year. That's all run on Impulsis technology, the same technology that underlies the IPC Health platform. So we work with about 25, 30 of the major medical societies where we are the technology platform for their content and learning delivery. And we work with all the major commercial medical publishers. So that's our background. As we were looking at India as a market, we wanted to look at what were the challenges were in terms of learning and development in the healthcare space. So we partnered with IQVIA last year to do research in India to see what was the market like, how did learning and development happen in the healthcare space. And we came out earlier this year when we launched IPC Health with the state of skills in the Indian healthcare industry report, which at the end of this session, we will actually send each one of you, all the attendees, a copy of that report, which gives an overview of where skilling and learning and development is in the hospital sector. But what we found from the report is a couple of key things. One was in terms of just availability of content and trainers. I mean, I think hospitals were challenged by trying to figure out if they had problems with training, how can they get quality, reliable content and reliable trainers to actually help their staff in terms of training. So that was a key piece. There was also problems in terms of compliance training. So there was low staff compliance. Also, in terms of managing training, in terms of reporting on the training, there was challenges with that. And then there was also, challenges of actually getting the right type of training modules, the curriculum to actually do the training for the hospitals. But hospitals also faced a lot of other challenges. One is just pure recruiting and onboarding. That whole process today, what we've seen and in the research was that very traditional, leveraging, traditional methods, brick and mortar methods of recruiting and onboarding. And hospitals did not really look at what we consider a key productivity metric that should be measured, the onboarding to productivity. And Varun will talk about that. It's when new nurses come on board, how quickly can you get them trained and ready on the floor to be productive, to deliver great care. So the OTP, or onboarding to productivity ratio, is really important. How you manage it is very important. Training and management, completely broken in terms of tools to actually manage. If you're a hospital with hundreds of employees, how do you actually know that person X or department Y have actually been trained all done by either Excel or pen and paper, no real software to actually manage that. The other key element was on NABH training for quality certification, really in terms of finding the right content, reliable content, and making sure everyone in your staff are trained so that you can go for the certification. And then the problem of actually having programs that you can actually have, your veterans in your organization to continuously have CME and continuation professional development. So really, if you look at the current system, it is quite inefficient and a lot of challenges. Again, paper-based assessments and training, lack of real technology to help on recruiting and onboarding. And really, as you bring in people, how do you actually manage them throughout their career and help them actually progress with their career? And finally, really, you need to do training and development, but you also have a care to be delivered, so everyone is busy. So how do you actually make them come to a classroom on a scheduled time and really efficiently deliver that training? That's a big challenge. So only way you could actually solve these challenges is really leveraging technology. And we see in countries like the US that there's software to manage talent. And it's really, really interesting. If you think about your hospitals, you do have software, an HIS system that manages the full hospital in terms of managing the hospital. You have accounting systems to manage accounting. You have a lab management system to manage the laboratory. You even have a HR system to manage HR. But I think, if you think about your greatest asset is your employees. And if you don't have software for that, it's ironic that you can't really get the most out of your greatest asset. So that's something that was really key for us. And we said that we've got to build a software that could actually manage your greatest asset to actually improve them and deliver great care. So there was nothing like that in India. And that's where we came up with the idea of iPC Health. So what iPC Health does is helps in the learning and development needs to improve the delivery of quality care. First basic thing, it's a comprehensive learning management system. A comprehensive learning management that is mobile first, so that that we can actually deliver to the ambulance driver or to your cardiologist. So that's number one. Number two, it's really great quality compliance training. We've got content that will help you with obtaining NABH certification through all the right training materials around that. There's great content around induction training. We have a system, not only for online training, but for all your offline training, your classroom training, a system to manage your training management system. And then we've actually just deployed our iPC Health Communicator, which is, with the COVID pandemic, we saw, meetings like what we're having today be a great tool to communicate. But within your hospital, how can you use that? And we'll talk about that. And then we have our content marketplace, which Dr. Rayna will talk about. But the three key things that iPC Health delivers to you, first is world-class technology. So you're going to have the best of learning and content delivery technology. The same technology that we at Impulsus use to power hundreds of education companies around the world. Second is really looking at how you manage learning and development, how you manage talent, and coming out with tools that are actually helping you eliminate inefficiencies. And we'll talk about that. Dr. Rayna will talk about it, and Varun will talk about some of those inefficiencies and how we can save you money in those workflows. So second is that. And third is incredible, valuable industry content. Dr. Rayna will walk you through that. And we're really in day one of our platform. So we're really excited about the innovation that's going to happen. So what are the core features? One is a training management system. We really were surprised that none of the hospitals actually had a system to do training, even though everyone did training. Every hospital has a training program, but they did not have software to manage it. It was either on Excel or on paper. So we have a great training management system that will allow you to do offline training, assign classrooms, send out notifications to your employees saying meet at a particular room and have the training, have the instructor, have attendance, all of that. Second is giving you control to actually build your own courses. So you have a PowerPoint, you have some question answers, and you can quickly put together a course. You have a new policy that you want to actually implement across the hospital. Quickly put the course, put the course together with the course builder, and boom, release it to all your employees, and they are now well versed with the new policy. Second is content uploader. You want to deliver this content. It could be anything from books, or it could be a policy. It could be a new memo from the CEO that you want to deliver across in a managed way. Today, people do it through WhatsApp, but how do you know that person X or person Y actually have taken it? So that's a content uploader. The health talent assessor is fantastic in terms of the whole recruiting process, eliminating inefficiencies there. And I think Varun and Sai, as well as Dr. Reina, will talk about that. And then we're really excited about this. One of our latest feature releases is really we've integrated Zoom. We will be integrating Google Meet and Microsoft Teams. So this is our communicator is a great way for heads of departments or the CEO to have a way to communicate through your whole organization, a way to schedule, a way to let your employees know what time it is, and have them actually attend through a Zoom or a Meet or a Microsoft Team, but all managed well within the IPC Health ecosystem. And the IPC Health Classroom is a virtual classroom. Again, we've leveraged Zoom and we're going Google Meets and Microsoft Teams technology to do that. So all of this has allowed us to create real value. We launched the platform only a few months in February, end of January this year, and we've had tremendous response even through the pandemic. I mean, we've had some great stories of how hospitals have leveraged IPC Health to actually do contactless training. So we have over 113 hospitals. We're talking to a few hundred of hospitals right now, and they're in different stages of signing up. We have about 24,000 users on the platform. So it's tested and it's improving. Because it's a software as a service solution that's on the cloud, we're continuously adding new features, and it's really exciting. So we're going to talk about multiple things during this presentation. Next, we're going to have Dr. Renu talk about content and how we're looking at that aspect of delivering value there. And from our research that we saw at IQVIA, that getting a source for reliable content, really solving that problem for all hospitals. And Dr. Renu will tell you how we're solving it. Dr. Renu, over to you. You're on mute.
Good afternoon, everyone. It's a pleasure to connect with you all as we near the successful completion of 1 year of launch of IPC Health. Over past 1 year, we have become the trusted partner for training content for over 100 hospitals. As per the IQVIA research report, getting a reliable source of training content is one of the pain points of most of the hospitals. Impulses, by virtue of its long-term relationship, that is like almost 20 years of relationship with renowned international medical associations and medical publisher, is ideally positioned to be a one-stop platform for all the content requirements of the hospitals. IPC Health offers a wide range of content from induction to soft skill to compliance to certification programs to address the learning and development needs of the hospitals. We also understand that every hospital's L&D department has its own training content that they would ideally want to host on an online platform. So IPC Health also provides support to hospitals' L&D in building this customized training program. over the past 1 year, we have had some good success in creating such customized online courses for our partner hospitals. IPC Health offers induction training modules right from hospital emergency codes to patient safety, hospital infection and prevention control. These modules help to onboard and to induct new talent into the system with relative ease. Next is a compliance training modules. Our compliance training program guides the hospital to comply with the training and development needs set by the NABH. We offer 60 hours of training content in areas such as medication management, patient care, laboratory quality assurance, facility management, hospital infection prevention control, and other critical areas within the healthcare organization. Both these induction and the compliance program are offered free with the IPC Health subscription. So besides the induction and the compliance program, we also have soft skill courses that help equip healthcare staff with the right skill and confidence to handle all kinds of challenges that they face at workplace. The modules, the soft skill courses cover various domains of learning, right from effective communication to learning about Excel, Microsoft Word, PowerPoint presentation, to negotiation skills, time management, professional development, and leadership and managerial courses, thereby supporting the overall development of the healthcare professional. In the past 1 year, we have been getting requests from our partner hospitals to provide them with reliable and relevant content on COVID-19. So keeping this demand in mind, we have created a COVID-19 resource center that hosts learning modules and the webinars that we have conducted this year. So useful nuggets of information right from infection prevention and control in the COVID-19 context and the diagnostic approach and subjects like managing stress among healthcare professionals are available in this COVID Resource Center. Anyone can visit the resource center and can access this information for free. Then one of the innovative offerings from IPC Health is the Health Talent Assessor. This is a tool to evaluate healthcare staff on an expected level of knowledge and skill set. So it offers model tests that can be used as an assessment tool for testing like entry-level nurses, like for recruitment purposes, or for testing the experienced or specialized nurses in the ongoing trainings that keep happening in the hospitals, and for NABH audit purposes. In fact, hospitals can also create their own, they can upload their own questions, and they can also create their own exam for the staff assessment. Then moving to the upcoming content offerings, I'm very pleased to announce the launch of our RCNI certificate program in February 2021. So IPC Health is collaborating with RCNI, which is a subsidiary of the prestigious Royal College of Nursing, to bring to India continuous professional development courses from a broad range of specialized nursing care topics. The content ranges from clinical topics to self-development to specialized topics like palliative care, diabetes, end-of-life care, medication management, pain management, geriatric care, and other such topics. So this program will not only help nurses to enhance their skills, but it will also help them strengthen their career progression path. And at the same time, it will also keep them updated about the latest practices or the best practices in nursing. This program will be available as an annual subscription. It's available for both hospitals and as well as individual users. So this program has around 60 courses. So on signing up, you get access to 30 courses, and rest of the 30 courses will be added up as 2 new courses added every month. Then IPC Health is also partnering with American Heart Association to bring ACLS BLS certification program on the platform. So the interested healthcare professionals can apply for the certification through the IPC Health platform. So this is going to make the certification program very easy, simple, and accessible. So this is something that will be launched in the second half of 2021. Then another offering from IPC Health in 2021 is the content marketplace. So we'll soon be launching a content marketplace for healthcare professionals. Now, our association with renowned medical publishers and with medical and nursing associations and with training providers enable us to provide you access to world-class content at the click of your finger. This content marketplace will give you access to books and journals from top medical publishers, and soft skill and healthcare courses, and continuous professional development programs from international training providers and associations. Year 2020 has seen a paradigm shift in both teaching and learning methods. Learners have moved to virtual platform, and whether it's in school, higher education, or other professions. And healthcare sector is not far behind, as we have seen how the knowledge sharing is happening in recent times through webinars and through online training programs. IPC Health is a one-stop solution for the learning and development needs of the hospital. It brings world-class content to you on your personal devices. And most importantly, it's a reliable source of content from renowned medical publishers and associations across the world. Thank you very much. And now I will hand it over to Dr. Poonam, who heads our impact management, and she'll be talking about the customer engagement activities that we do at IPC Health.
Thank you, Dr. Renu. Good afternoon to everyone, and thank you for giving your valuable time to attend this webinar and understand what IPC Health is all about. Impact management. So this term might be new to you, I think for most of the people. So what exactly is impact management? Impact management is a team of expertise which basically come from healthcare backgrounds, and we align with hospital to understand what exactly is the training requirement. We deliver them, we understand the gap, we define those gaps, we try to bridge those gaps and deliver what exactly is expected in terms of training outcomes from the healthcare workers and from the hospitals. So what exactly we do? To concise, we actually give a 360-degree help to the hospitals and the healthcare service providers. The entire cycle starts with product implementation and training. We look into healthcare workers, we align with their training programs. We look into platform adoption, staff motivation, and of course, the feedback and the report system. As we said, 360-degree approach. So our approach is 360-degree approach in terms of we first understand that what exactly is a hospital requirement in terms of training. So the first phase we give, how does the entire impact management and the relationship building phase is built up through the hospital. So the first phase starts with the introduction of the product to the hospital. So the team of expertise first help the hospital to understand the product in detail. Then in the later stage, once the hospital move ahead and go ahead and implement the product in the hospital, then we try to understand what exactly is a hospital looking in terms of training and development. What are the gaps they have? What in terms of content they are looking for? What in terms of training delivery they are looking for? And we try to analyze those gaps. And then in the third phase, we get into the implementation phase. So implementation phase is a phase where we implement the product in the hospital. We align with basically the quality people, the HR, the nursing team, and the other managerial departments. We implement the product into the hospital through the training and the product knowledge. We do the onboarding. We bring all the users to the platform. And then in the later stage, we stabilize the platform. So what a stabilization is, that once the platform is adopted in the hospital try to understand the platform, the user try to understand the platform, and then we stabilize the platform in terms of regular feedbacks, regular reports, and understanding what exactly is missing in terms of training that we can bridge into. How do we help? So we'll basically look into 3 key areas: user management, user engagement, and customer satisfaction. User engagement in terms of we help the hospital understand that if they have delivered certain kind of training, what is the number or what is the percentage of those staffs who have taken those trainings? Or in terms of reports, we help them out understanding the platform utilization. We help them with various kind of reports, various kind of analysis in this segment, so that the hospital is able to understand the entire user engagement and user management. Then in terms of specific user engagement, we look into the all-time availability of content. So yes, of course, when you have IPC Health in your hospital, you would look into the kind of content which we offer. So what Dr. Renu has covered in the previous presentation, there are various kind of contents which we look into, but if there is certain specific kind of requirements which come from the hospital in terms of content, we do look into that, and we look into how we can engage the users through those contents. We do regular webinars like what Dr. Renu told. We also do certain other kind of user engagement activities in terms of quizzes, in terms of other kind of competitions and different kind of awards, because we believe that there has to be a certain human touch to the hospital staff, and only that is something which can really motivate for them to go ahead and start taking these trainings. In terms of customer satisfaction, yes, so customer satisfaction is the most important thing which we look into. We look into how we can improve the productivity and improve the entire healthcare outcomes of the hospital or the any healthcare other healthcare delivery system. We look into periodic surveys and feedback. So when we say customer satisfaction, we also look into our net promoter score. We take periodic surveys with the hospital, try to understand how happy they are with our product and what is that missing which is needed from their end and how we can deliver that. We also look into the timely updation on the product features. So if some, as Sameer told and Dr. Renu's told that we have launched few months back, we also look into how we can enhance the product from a customer perspective. So if a customer come to us, say that there are certain things which are needed from their requirement, we look into that and we make sure that we deliver that. Thank you all. So I now move to hand over the session to Mr. Varun, who is the National Sales Head. Varun, over to you.
Hey, thank you, Poonam. Thank you, everyone. Yeah, can you stop sharing? One sec. Good afternoon, everyone. My name is Varun. I head the sales and business development for iPC Health. So right till now, what we have covered is Sameer talked about the introduction, of IPC Health. Like why we are offering our services into the Indian healthcare system, because we realized when we did the IQVIA study, we found out that there are a lot of inefficiencies which exist in the hospital, which we thought that with our technology solution and our, of course, the content offering, and with the feature and the functionality which the IPC Health platform offers, how it can really helps in eliminating or at least reducing those the inefficiencies which currently exist in most of the hospital setup in India, especially the smaller and the medium size. So I will touch upon the how IPC Health is priced, and of course when we talk about the price, we will also talk about what value it brings for that price which the hospital management would be charged for the year. And then at the end we will have some of the examples, like how the features which are available on the platform, it's really helping you save money, and obviously because of some of the features also helps bringing or rather streamlining the processes, right, and thereby increase the productivity of your staff. So coming to the pricing part, IPC Health, the platform is an annual subscription which a hospital takes up. And then we have kept it very, very simple, because we have realized after having our beta for 2 years in the healthcare market, especially in Bangalore, and then we have come up with the very simple pricing of so obviously it starts with the free trial. The free trial is something where all the hospital management and the key stakeholder, the HR department, the quality department, sometimes the operation gets involved, whole management, they want to see and try it first at with the key stakeholder, that how it really works. So that we offer without any payment, and you can cancel it anytime within the first 30 days if you don't like take it further. Yeah, but really starts the pricing for up to the 100-bedded category. So we have seen across, so we have 100-bedded category hospital, we have 100 to 250-bedded hospital, and 250 to 500-bedded hospital, and 500 plus hospital. It's really 1 lakh up to 100-bedded hospital a year which hospital pays, and we get all the feature and functionality which IPC Health offers. Of course, it also gives you the content which is owned by IPC Health. And then there are add-on, which you see, which Dr. Rainey talked about in her presentation, be it the ACLS, upcoming ACLS, BLS certification program, which will be, I think, coming up in the H2 of this 2021 year. And then, of course, Dr. Rain talked about the courses, and that is an add-on module. And similarly, for up to a 250-bed hospital category, you have 2 lakhs per annum fees, which you pay, and then it's annually recurring. So you pay. I mean, and if you don't like it, then you can just plug it off. Yeah. And for up to 500-bed category, you pay 3 lakhs per annum. And then for 500, any hospital setup which is having 500 bedded and above, they pay 4 lakhs rupees plus taxes every year. Now, we also wanted to talk about, how our feature, which are available on the IPC Health platform, helps you save cost now by bringing more efficiency. So, to before I move forward, I just wanted to bring in some of the assumptions which we have taken. These are based on our learning and our association with our partners, all the 100 hospitals whom we are working with. Right now, we are taking assumption of 200-bedded hospital, where we are saying that at least that 200-bedded hospital will have 500 staff. It can go up to 1:4 ratio, to 1:6. But I'm just for the calculation purpose, we are taking 500 staff, and we know that the average salary of a nurse, and the paramedical technical staff, at least the fresher, start somewhere from 12 to 15,000, and we hear different, shifts, how many hours they really put in, works. I mean, yes, during the pandemic, it is the staff have really stretched, but we are saying 10,000 per month salary of a nurse for our assumption, and then 8-hour shift, and then trying to kind of really think through, like, how much does it cost, I mean, a man-hour cost, if they are being paid 10,000 a month, and they're doing an 8-hour shift a day and working 26 day a month, right? It really costs, like, the per hour cost of that person is 50 rupees. And then we are obviously talking about some of the operational cost and challenges. One sec. Yeah, which really involves it's a whole infrastructure, the admin cost and the manpower and the time, the manpower is spent, in managing those inefficiencies. So coming to the first piece, as Sameer rightly talked about in his presentation, that in today's time, every hospital, small or big, we all want our staff, especially the one who is coming, on a monthly basis, because hiring is a continuous process. The induction, we want them to be productive as fast as possible so that they can start delivering better care to the patient. And right now, how it's happening in today's time is most of that process, it's done manually. With IPC Health, this platform gives an opportunity to put all your induction courses and the onboarding, the entire process, which probably takes 4 to 6 weeks. That's what we have learned from our engagement with the hospital. If not more, at least it helps you reduce that. Can we reduce that time of 4 to 6 weeks to 3 to 5 weeks? And say, okay, 25% of the time, was saved while they become productive. So that the time which they save, and if you convert that, into per hour cost, I'll talk about that, what value it comes out to be in my last slide. Yeah. Then I touch based upon like how IPC Health features helps you save on the administrating creative work. What I mean by that is, right now, like how Samit said, the IPC Health, one of the key feature is our communicator, and also the classroom, which we have just launched. And recently we have launched the training management system. If you read what all of these features, what they offer, right? Right now, if you have to do an online meeting, you will be using, either a Zoom meeting, or a Hangout, or a WhatsApp, or any other virtual meeting tools. But what IPC Health have done is really integrated Zoom onto the IPC Health platform itself. Imagine if a hospital, 200-bedded hospital, you have 500 and above staff, and you want to address all your staff, on the same day on a short notice. How do you do that today? You'll have an executive, finding out all the email, if the emails are there or not there, the mobile number, all of that. And then, getting a Zoom link, or sending that, through the email, then following up, you know, and then on that, when the meeting gets over, how do you, manage and track the record, like who's joined that meeting, who didn't join that meeting, all that, you know, is available on IPC Health platform. So it enables hospital to conduct your, meetings and webinars. It helps you in view and download your records. The training management systems help you, not only do that, even uploading historic training data, gives you a lot of reports and analytics. You can even calendarize your, all your stuff, yearly training program, those 50, 60 mandatory, hours of training which you're supposed to deliver, which your, either your nursing educator, or, a training department, or the L&D department, or the HR department is doing. All that can be put on the training management system, right? And then it also helps you capture the training hours and credit point, which are probably mandatory as per the NABH standards as well. Yeah. And then again, when you put that all, administrative cost, right, but someone is doing this, right, either an executive, or an HR manager, someone is driving those, pieces right now, in the absence of a digital platform. So when we use this digital platform, IPC Health, it definitely helps, in reducing your administrative cost by 20%, and as I said, bringing in more efficiency in the training and whole training lifecycle management, right? Be it HR department, quality, and operations. Uh, I would So the other key element of our, or other feature of IPC Health, is the talent assessor. Uh, what IPC Health does here is, as we all know, in the hospital setup, we are, all the hospitals are, really facing each other attrition, which is like sometimes vary from 15-20% annually. And imagine if you have 500 and above employee, every week, or every month, there are new, joining, which are coming up. But we cannot control the attrition, you know. But what we do is, because of the continuous attrition, we are also having continuous hiring at the same time, and the HR and the operation and the training department, incur the same cost again and again. What IPC Health Talent Assessor does is, reduce that candidate screening time which you do, at your premise. Let's say, for example, how you do it today. So if you want to do a drive, you'll have to first find out those candidates whom you want to interview. You'll call them to a, specific day. They'll all come and sit in a classroom, or in a hall room. Then you'll give them a physical paper. Then somebody has to, collect those paper. Then you'll have to, then you do the assessment, you get their score, and then you find out at the end of like half a day, if you invested. And then you realize, okay, after the 50 out of the 50 people who came, to give the interview, only 5 were eligible or screened to get to the next round. And not to forget the cost of the, HR, or the head nurse, or the head of IT department, who would have, blocked his time to take those interview. Look at the inefficiency. But IPC Health Analysis helps you exactly do that. It helps you reduce your screening time of the candidate by 50%, because you can do the assessment online, while the candidate in the classroom, just assign the course on the mobile. Candidate can open the assessment on their mobile, take the assessment, boom, you get the result, on your system. Whom to take it further for the further round, and you'd only interview those candidates. So reduce the time, the time which you're saving, you can actually hire more people in the same time. Yeah. And then again, I'll talk about how much money you save from, IPC Health Talent Assessor. Uh, this is one of the key elements which I wanted to talk, and maybe invest one more minute here. Um, our virtual class, which Sameer also did talk about, and we know from an assumption that every hour of a staff who is being paid 10,000, cost around 50 rupees for hour. And then right now we're doing, what we understand from a hospital is like every week, there's a calendar which runs for the entire year. So you're doing every week 1 hour of training, and then in a month you're doing 4 times, and then for a year you're doing 48 times. So if you convert that all into money, one nurse 1 hour cost is 2,400, and similarly for 100 nurses, it costs 2.5 lakh. And if you calculate for 500 nurses, it goes up to as high as 12 lakh. And we don't even realize of this cost. But if can you do that, can you reduce by the use of IPC Health Virtual Class feature, all your users are already onboarded. Can we reduce that 1 hour every week to 1 hour training every fortnight, every 15 days? Instead of doing every week, you do every fortnight, and thereby saving that 2 weeks of the time which your staff would be spending in the classroom, in the physical classroom, in the hospital setup. Rather save that time and that help that nurse deliver better care to a patient who's in need, maybe in an ICU or at an emergency, right? And again, look at the cost saving. Instead of 12 lakh, if you reduce that time, of physical classroom to half in a month, it helped by the end of the year, it actually helps you save almost 6 lakh rupees. So overall, we talked about how the webinar helps you bringing efficiency in your system, and how the HR team can save almost a lakh rupee from here, and the faster productivity of your staff. For 100 nurses, it's almost 3.5 lakh rupees if you convert. Then the hiring cost reduction, helps the HR team save almost half a lakh. The operation, the three MS, I mean, which I just talked about, helps you save 6 lakhs. And then, the training department, if not more, at least save a lakh rupee per annum. So overall, what we're saying is, a hospital can actually save, a 200-bed hospital can actually save in a year 10 lakh rupees, by using IPC Health. And maybe the management will be happy to see that they get their return on investment with just in the 6 months of the investment. Right. So with that thought, I now hand over to Sai, who is our product manager, and he will take you through the quick demonstration of a product. Sai, over to you.
Thank you, Varun. And thank you everyone for your wonderful time today. Yeah, so I'll be demonstrating the capabilities of IPC Health today. So IPC Health, like what do we do? Like we support the learning and management for the hospitals. So when we talk about it, we have a training management that will be conducted by the admins, and then the hospital staff who go and learn that specific training which is assigned to them. So as a learner, right? First I will be covering the learner flow. Once I have completed the learner flow, I'll quickly take you through what are the admin capabilities that we have as part of our product. Okay, so each hospital, once implemented, will have a specific site enabled for them. Here I'll be demonstrating you through demo.ipchealth.in. You see an explore page. So explore page is the page where we list all the content that we are adding to the system. So which was discussed by Dr. Renu in the initial stages. So if you see here, all these categories here will help you understand the different type of content that we have added to IPC Health platform. If you take COVID-19 program, so we have list of courses that has been assigned as part of the COVID-19 program. So these are the free courses that each hospital who's onboarded as part of our platform will be subscribed to. In case if any hospital is interested on any specific content that our content team is adding to the system, you should be able to browse through this specific page and see, raise a request back to our sales team. The sales team will coordinate with the content team and the product team and get it subscribed for your hospital. So the main purpose of Explore page is to keep the hospitals and the users aware that these are the different types of courses that is being offered as part of our platform. And apart from the categories and courses, we also will be broadcasting any new courses, the trending courses that we have added new to the system that helps you understand and get the focus on that specific courses for the hospital staff so that they can benefit out of it. Okay, so this is on the Explore page. Now I'll quickly log into the platform. The moment I log into the platform, I'll be able to see my dashboard. What do I do with my dashboard? The moment I log into the dashboard, I should be able to see a quick summary of the number of credits that has been assigned to me and what I have completed, and then a leaderboard. This leaderboard helps me to quickly see my ranking for that specific month. The leaderboard here is a monthly leaderboard. So I'll quickly click on the credits page here. Yeah, once you click on the credits page, you should be able to see all the courses which you have completed and you have gained the credits for, right? And we also provide certificate when a specific course that has a certificate, the user can click on view certificate option. The moment you click on view certificate option, the certificate can be generated and downloaded for that specific user. So what does this help? So this creates a culture within the hospital staff to ensure the completion of any specific training. And this certificate template, what we have at this moment is a standard certificate, but however, we will be leveraging this template into multiple templates based on individual courses as part of our roadmap. And if you see here, as part of our certificate, you should be able to see the name of the user who has completed that specific program and the name of the program and the credits code. And also if it's been presented by any signatory authorities within the hospital, that digital signatures can be attached as part of the certificate. And again, this certificate can be downloaded and added to the personal binder of individual hospital staff for audit and other purposes, compliance purpose. Now, moving back to the leaderboard. So what do we see in the leaderboard? The leaderboard is where the first 3 learners across the complete hospital who has completed those trainings and who's leading on that specific month will be displayed. What does it do? This creates peer pressure, and it also gives an environment for the people to compete within each other in a healthy way so that they can lead in the leaderboard. And even to add up to that, our impact team, along with our marketing team, conducted all the engagement activities, and we have been handing out goodies to those who has led in that specific month on a specific hospital. Yeah. Moving back to the calendar. So as a learner, the moment I log into the system, I would like to know like what is scheduled for me and what is due for me to complete on that specific day. This gives a clear direction for that specific learner to quickly go click on the calendar and understand the list of courses which is starting on that specific day, so that the user can click on the start button and launch the course. Likewise, there are courses which completes on that specific day, the user should be able to see and ensure that he completes on that day so that he is compliant with the learning goals set as part of the organization. So this is the training calendar. If you see here, the dots below represent the courses which were tagged on that specific date for that specific user. If you see, this is on the training calendar functionality. Now, coming back to the My Assignments page. So you should be able to see the courses which are assigned to you. So we have classified the courses into different categories. One is e-learning, that will cover your ebooks, courses, and all other video and all digital content. Now, what is webinars? Webinars, as Sameer and Varun rightly spoke about our communicator, we can now go and schedule a webinar through iPC Health, and same webinar can be scheduled to a group of users or all the users within a hospital. So the moment you click on the webinar, the user will get a listing of that specific webinar in his dashboard. So he should be able to go and see and join. See, these are all past due webinars, so the user will not be able to join, but through here, just a click of a button, the user should be able to connect seamlessly to that virtual classroom or webinar. Now, with regards to classroom, iPC Health now supports virtual and physical classroom. You can now go ahead and schedule a classroom session through iPC Health and tag the users to that specific session. So user can join that particular classroom, come here and mark their attendance, and admin themselves can override that attendance as well. So I will be quickly showing you that as well. Now, the training program. This is one of the latest feature which has been enabled as part of the system. And this is one of the key features which Sameer was also addressing about the training management system. What it helps is, if you see here, you should be able to see a training plan which was created. And these are the list of courses which were added as part of our training plan. Likewise, you can define a yearly plan for nurses or for doctors or for any specific fraternity, and you can design the training plan and plan the complete year on what has to be achieved. So by doing this, you can also tag it back to the learning goals and the compliance objectives of the hospital staff. Yeah, I'll quickly launch a program and quickly show you how the versatility of our content. Introduction to NABH. We have a dedicated team working on our content, ensuring that we are giving the world-class content to the hospital staff. Yeah, each course is designed in a way that you will be having a quick introduction followed by a pre-test and the content of that specific course. And towards the end, you have the post-test through which you can validate that learner has learned and understood that specific topic. So in the interest of time, I'll just quickly take you through the pre-test and move to the next set of capabilities. Yeah. So the user can actually go select the specific answer and move next till he completes. And we have a robust exam engine through which the exam questions will be randomized and will be populated for that specific user. And also, so we are in the process of leveraging our exam engine where user will be able to get a different set of questions based on weightage, which means each user will get a different set of questions for them. Yep. So this is with regards to the dashboard on the portal page. As discussed earlier, IPC Health was defined as a mobile-first solution, right? What does it mean? See, any learner could access the platform through their mobile phone, even at their leisure time, right? When they are traveling or when they are at their breaks. So I'll quickly stop sharing the screen and quickly share my mobile screen so that you should be able to feel the app experience. Yeah. So if you see, so we support iOS and Android applications, and each user can download this app either from the Play Store or from the App Store. Once downloaded, you will get the Explore dashboard in the download page when you log into, when you launch that specific app. In the Explore page, what you saw there, you will be able to see the same components here in the app as well. And with regards to dashboard, you should be able to see all the content within the dashboard. Yeah, the user can quickly navigate to the assignments, the learning modules, the webinars, the classrooms within the app. Yeah. And the user can also download any specific course for offline learning, which means even without an internet availability, they should be able to read the course at their leisure time or at their free time. Yeah.
Thank you, Sai.
Yeah. Yeah, I'll quickly touch upon the admin capabilities. So what you see here, the admin modules. So
because of time, I think you'll have to quickly finish through that. Yeah.
Sure, sure. The hospital admins can download the reports and run their pivots on top of the reports in the Excel file, right? This is a sample report which has been downloaded. So if you could see the complete data for that specific learners across that platform has been downloaded. Likewise, they should be able to download the training record of each individual learner. And this is the candidate flow what Varun has explained with regards to our health talent assessor. If you could you should be able to create an evaluation, an internal evaluation that's to measure the progress or the performance of the candidate of performance of the staff within the system. And also you can also create an exam and assign it as an interview or an evaluation to a candidate. So if you see here, this is a sample candidate assessment record which is generated out of the system. So the candidate ID provided is CAN24, and based on the passing score, we will define whether the candidate has passed that specific interview or not. And the same candidate can be converted into a permanent employee within the system as well. Once you go click here and convert them to a permanent user, right? And with regards to training management, this is where that you create your training programs, the training plan. The complete admin module enables you to manage the training and delivering the training effectively. Yeah. And thank you for your time listening to me on this specific demo, and over to you, Richard.
Thank you, Sai. I would like to thank all the speakers for giving their valuable time today. We would like to take you through some of the testimonial videos of our clients. We will be taking the Q&A session at the end.
Sameer, can we take the question first?
I think because of time, Richa, the testimonials we can wait. We'll actually we'll just go on with the Q&A because we're running out of time, right? So why don't we Q&A? Yeah.
Sure, Sameer. We already have some questions lined up. The first question is directed to Dr. Renu. It says that, can we have the content in local language?
Currently, we are not offering content in local language, but if we are open to the idea, and maybe in 2021, maybe as per the demand, we may come up with local content.
Okay.
As of now, it's only in English, but hopefully by year 2021, if there is a end of year 2021, if there is demand for local content like yours, we might come up.
Sure. Thank you.
Also, because of the course builder, the hospital can create their own local language courses. So if there's local language, which is in PowerPoint in local language, with audio in local language, and a test, you could put it together with the course builder and actually deliver that in local language. But we will in the future have local language. But right now, in the first phase of go to market, we are focusing on the broader market, which is primarily English.
Sure, Sameer, thank you. The next question is for you, Sameer. If the hospital requires specific content, can you source the content from global publishers?
Absolutely. I think that's where our real value comes. With our 20-year experience working with some of the biggest publishers in the world, the publishers are really excited about iPC Health and having the distribution into the local regional hospitals. So Dr. Renu leads the content strategy team. She has a few team members that are focused solely on sourcing. So we can source that content from the bigger publishers or even smaller content, either books, journals, journal articles, and courses to help you with your training and development. Richard, there's some more questions on
Yes, Sameer, I'll just take them up. So there's one question from Dr. Mukesh Yadav, who says that how can we utilize this platform for our faculty and students?
Yeah, so we do have, we initially started to work with some of the colleges, and we were getting adoption there, but because of the COVID crisis, we pulled back and we said that we will only focus primarily with the hospitals. But Dr. Mukesh, if you get in touch with us, we'll see how we can actually work together.
Yeah. Sameer, there's one more question from Maheshwaran Ashokan, who says, can anyone get demo access to check the future?
The features, right?
Yeah, features.
Yeah, absolutely. I think the free trial is there, and I know Sai did a fantastic job of doing the demo today, but I think there's a lot more that he can show you. We've got our sales teams across India. So based on which region you are, we can give you the demo again and also give you access to the platform.
Sure. There's one more question from the audience. That's for you, Varun. Is there a possibility to have a trainer physically to clarify any doubts unresolved after taking up the learning modules?
I think, Richard, thanks for the question. And maybe Dr. Renu, because this is more content specific, but I can add, so right now what we have, some of the program, all the modules which we have on a platform, and then if after delivering those modules, if you need, basically what I understand from the question is like they're looking for a physical instructor who can visit the hospital, and give a training, in the classroom. So I think we are building up a network of our, SMEs who will be, available, going forward, maybe in the next 6 months, where if you need those services, we can possibly assign, an expert who can, give you those training on the premise as well. Right, Sameer? You want to add to it?
Yeah, you've answered the question.
Yeah.
That's a benefit. Going back to the research, and what we found is that, finding great content as well as, good, well-trained trainers to train your staff.
Yes.
Our goal is we're bringing a network of trainers into our ecosystem so that you could actually find qualified trainers that can help you. So we're working with a lot of consultants to put that network together. We're going to be probably launching that as part of the content marketplace when we launch the content marketplace. So not only will you get books, journals, and courses, but you'll also get, trainers who have the skill sets to train those subject areas.
Sure. Sameer, there's one last question from Dr. Mukesh again, which says we're a government organization and we do not have that kind of budgets for such activities. How can we still partner with you?
Yeah, our goal is to improve the quality of care, delivery of care in India. So I think, and the way we've priced it was to aggressively price it so that we can get adoption across the country. There will be government agencies that probably can't afford it, or we'll need to work some things out. So, we're interested in trying to improve the quality of care. There's going to be ways that we can work together. Please get in touch with us, and then we can discuss that in a little bit more detail and then see how we can partner.
Sameer, these were the questions we had from the audience. Thank you so much, everyone. Now we'll be playing a short testimonial video of Dr. Naresh Shetty from MS Ramaya. He's one of our key customers, and we would like to take you through what he feels about IPC Health.
Yeah. Yeah. Don't worry.
The sound seems to be a little bit of a problem.
It's taking time probably due to the buffering. Can you click on the play button again?
Apologies, there seems to be a little error with the video.
Video link, yeah.
We'll share the video link separately to you post the webinar.
Thank you so much. I would like to thank all the complete audience for for taking out their time and attending this session. Post this webinar, we'll be sharing one mailer with a feedback form. Please do fill in your feedback and share it with us. Thank you so much. I would like to thank the speakers again. Thank you so much.
Thanks, Rich. And before we end this meeting, I think Sameer, we also wanted to say, the hospital representative who are, on this meeting, we would like to offer, an extended free trial of 3 months if they register today. So I think we will have some of those coming in. So we'll wait for your responses, and do register for a free trial up to 90 days or 3 months.
Yeah, and also we will be sending out the
IQVIA report
regarding the status of skill development in the healthcare sector. So we'll be sending that out along with the survey. So, but again, I want to thank everyone that has attended this webinar. Thank you for your time. Thank you for all the speakers here, and I look forward to, for all the hospitals that haven't come on board, look forward to engaging with you and helping you increase productivity and improve the quality of care delivery. Thank you very much.
Thank you all.
Thank you all.
Thank you all.
Thank you all.